As the next speaker, we'll invite the Latvian Minister of Health, Ilze Viņķele. And for years, Ilze has taken different positions in the public administration and parliamentary bodies. And since 2019, Ilze has been serving as a Minister of Health of Latvia. Today, she will talk about the state of play with health data in Latvia in the light of the challenges brought by the COVID-19. Do we have a connection with the Minister?
I hope so.
Good morning,
Good
Minister.
morning.
We can see you. How are you?
Well, thank you. I'm good. I hope you also are good and energized. Labrīt, good morning. May I start?
Yes, Minister, thank you very much. And the floor is yours.
Thank you. Distinguished speakers, ladies and gentlemen, let me begin simply by saying that we would love to see you all here in our beautiful Riga, but for obvious reasons, it isn't possible for now. This year has been a challenging one for all of us, all around the world. The pandemic has shown how fragile our societies are. At the same time, it has shown how much we can achieve if we work together. This crisis has highlighted the best in us. Just take various contact tracing applications we already up and running for developed COVID vaccines, for instance. These are truly fantastic examples of how science and data can help us move forward. However, there is a much more that should have been done, and there is more that must be done now. I truly believe that health is a precondition for our societies and economies to function. As we all now know, access to healthcare is one of the human rights. I strongly believe in that approach. Even though patients are the focal points of healthcare, they are not always provided with sufficient information. Some goes with our doctors and nurses, the same goes for also with our doctors and nurses, our hospitals and care centers. They all need better access to their patients' data to make their decisions, to increase access, to reduce costs, and to provide unfragmented care. There are lessons that need to be studied carefully. Wasted opportunities are terrible. There will be struggles and there will be setbacks. Building trustworthy system and earning public trust is probably the bigger challenge we have to face now. Therefore, collaboration is essential. We will succeed in this path if we will follow this narrative. Then I continue in Latvian a little bit. Dāmas un kungi.
Ladies and gentlemen, patient data is the basis for everything, and the Ministry of Health has shown its readiness to change the current state of play. Today we will hear several high-ranking experts and their experience that shows that the correct use of data is a benefit for both patients and healthcare professionals, for scientists and for healthcare institutions. This summit is a logical continuation of the work we have already started and the reforms we have planned. We have done the necessary work reviewing the ranking of our hospitals, and we hope that it will help us deliver the reforms that are necessary, and we have separated e-health from the development of its stage number 3. Our lessons and our experience is the topic we will discuss today, and I would like to address patients, healthcare professionals, IT professionals and private company representatives. Only by your engagement, and by this I mean the healthcare system of Latvia patients and doctors and other professionals. Only through your engagement will it be possible to create a better healthcare system by using the models we have with and combining them with the new models. Our healthcare system is facing several serious and brave decisions. One of these being that this type of approach, and here I mean e-health system that was developed more than 10 years ago, is obsolete and it has to be replaced. We can see that this is demanded by our public, by our healthcare sector. We see the system as a rigid and slow working system that is not up to the task today. The development of new services cannot be hindered by placing too much of a burden on doctors, patients. These groups have to take part and be present from the very start when we start to develop new solutions. Data, new technology, new way of thinking has to be the new normal in the way we develop and take serious and responsible decisions. This will not only make the reception of services more comfortable, but it will also make our system more efficient, reducing the number of necessary checks that need to be done and making the system more cost efficient as well, where we can direct the money saved to other needs.
It's been done already, but the great job still lies ahead of us. Now I wish you an insightful, forward-looking discussion, and I'll be more than happy to answer your questions on how we can ensure more sustainable health system in Latvia. Thank you.
Thank you very much, Minister. And thank you also to all the viewers. And as you can see on the screen now, you're able to ask the questions to the platform mentioned before, www.menti.com, entering the code 5035232, or just scanning the QR code next to the code. Thanks again, Minister. We have questions coming in, and let me start with the first one. How big of a role does data currently play in the decision-making process in the Ministry of Health?
That is a very complicated question. Thank you for asking. As I have said previously, decision-making without data is simply unimaginable. Just to give a glimpse of our everyday work, each morning we receive data from National Health Service on how many people were hospitalized over the past 24 hours, on how many COVID tests were performed last 24 hours. Soon right after we receive those data, we start to analyze them. But there is still a lot manual work, and that's of course slow down the process of decision making. To put it simply, that data is the core of our decisions, but we have to increase the ways and the speed and the options how we work with them.
Thank you. We have another question from the audience. Minister, data and technologies are already accessible to technology companies. And how can technology companies prove that, that us as a country are ready for public-private partnership principles, and what should private companies start with? This question was written in Latvian, so I'm trying my best to translate it in English. But basically, what can technology companies do to prove to the country that the public-private partnership principles are the way to go, and what should they start with?
Yeah, I think we have to touch a little bit. We have to look in the history and a little bit. I think both parts, Ministry of Health and also private companies have been a little bit traumatized by e-health experience that was built not on the clearest I don't know, agreements and and we suffer from this very painful experience. But definitely we have to start cooperation from the new page. And one of the brilliant example is up to the COVID product that was fully built on public-private cooperation basis. I think that is a very inspiring example, and we just have to continue that approach. And I can assure you I am ready to do that. And we have also now one more project ongoing where our Center of Disease Control now work together with IT company who can help to revise routine process and help to build a plan for automatization. So I'm hopeful for the future.
We all are. And I also have to just add that Latvia is by no means the only country that has struggled to implement the e-health system. Most countries struggle with that, and most countries can feel the same pain that we might be feeling sometimes. The next question.
That is good to know, but that doesn't help, actually.
True. What are the next priorities, the next steps in digitizing healthcare services?
Patients should always be in the center of our attention, and taking this into account, we can build the necessary systems. Another important aspect, I think, is to reinforce our preparedness and response during health crisis such as this pandemic. We are working now on digitalization strategy for our biggest hospitals and comparable data sharing system is one of our nearest future priorities.
Mm-hmm. We have one more very good question. Is Minister ready to propose a development of Latvian digital health strategy to establish the future vision of our healthcare system?
I am more than ready because I realize that without this, we cannot move forward. And if we don't have such a strategy, we actually suffer from lack of effectiveness. And I just cannot imagine how we cannot do this.
Mm-hmm. And another viewer asks, when will there be a possibility for a patient to see their health data, her or his health data, on Latvian e-health system? Is there any indication on the deadline?
Some information is accessible now through the e-health system, but we are working to improve that, and I would say during the next year the amount of data accessible through the e-health system, I hope that will be in the greater amount. That's not easy question to answer, to be honest.
I believe you. Is there? Are we thinking about 1 year, 2 years, 3 years, 5 years time?
I think that is a step by step, and I think it's impossible to reorganize all e-health system in 1 year. I think that will be the process step by step. Next year, one part, and then hopefully in 3 years we will rebuild a new e-health system.
And actually, a follow-up question to that, also from the viewer. So if you could just clarify, so what is the plan for the new e-health system? To build it completely new, or maybe take some ready-to-go solution that's already on the market in another country?
At the moment, we are working to improve those modules work more or less successfully. That is e-recepte and also sickness leave digitalized and some other modules. And parallelly, we build the system that, like a platform, we can reattach those recipe and others working modules on this new platform. But I think the news is that we realize that IT solutions change now so quickly that the main goal is to build system that every module could be attached, and that is the approach we try to implement in the future solutions.
Thank you. I'm sure the viewers are appreciating these answers. And let me ask you one more question. What would you see as a task to do in the next 4 weeks to make progress in the digitalization, in the data implementation, in decision making? What do you see could be done in the next 4 weeks? Maybe that's a bit hard to answer, let's say the next 4 months, but what should be done soon to make improvements?
Actually, I can answer this at least on one project. We desperately need to digitalize this COVID positive test data analysis in our Center of Disease Control. And without that, actually, the risk that we stop our productive working is too high. So, and I think that is an urgent need, and it could be done in 1 month.
Awesome, amazing. There are really so many questions coming in, so thanks a lot to the viewers. I'm just gonna ask the very, very last one. What can I as a patient do to help in the process of digitalization?
Be healthy. Probably it's a very valuable output from the side of patients. I think in the process of digitalization, the burden of the workload actually is on the side of ministry agencies and hospitals. Patient just should be satisfied, and the access to patient's data must be provided. I think the patient is at the center of the system, and patient has to think about his or her health and well-being, but not to try to help with data. That is our duty.
Thank you very much, Minister. I'm sure that the daily life of a Minister of Health in European Union and all over the world now is a hard one. What is your daily life now, since the COVID pandemic has started?
Diplomatically speaking, very challenging, especially today.
All right. We wish you the best of luck with today's work, and we hope to see you at the end of this summit today to share some thoughts and maybe wishes for the future.
Yeah, thank you very much, and have a fruitful discussion.
Thank you very much. We'll see you soon.